Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, this is Cindy with another episode of Spectrum Perspectives. Now, you may have noticed in my first few episodes, all of the moms are single moms and they're divorced. So I've decided that the way I'm going to lay out this podcast is for the first 3 weeks of the month, I'm going to interview parents. And then the last week of the month, I'm going to interview professionals. So since all those moms were divorced and raising their children as single parents, I thought what I'm going to do is bring in my friend Carolina Denhart, who's a divorce attorney. But then I'm going to speak to a therapist who will talk about addressing families and helping them through situations like having a child diagnosed with autism, and hopefully give some helpful tips on how a family can stay together. So in today's episode, I'm bringing in Dr. Jackie Black, and she specifically works with families that have critically ill children, have dealt with the loss of a child, or have a special needs child. So she's the perfect person to bring in to give families some help and some advice. So stay tuned for my interview. And as I was speaking to Dr. Jackie, she actually brought out some emotion in me that I wasn't planning on. I did not expect to start crying in the middle of our interview, but I guess she's very good at what she does. So stay tuned and listen in to Dr. Jackie. So today we're meeting with Dr. Jackie, and she helps to coach families, and I'm going to let her explain to you what it is exactly that she does. Welcome, Dr. Jackie.
Thank you so much. It's great to be here with you today.
So maybe you can just give me a little bit of background about, who you are and what you do and how you got into what you're doing now.
Okay. I transitioned out of therapy. I'm a PhD psychologist, and I transitioned out of doing therapy into doing coaching in 1999. It was a 3-year transition. And the reason that I did that was that I work with couples and families. Families with ill children, families with whose children have died, children who are ill. And it's not therapy. It's not that there is a therapeutic dynamic that needs intervention. It's about life and how to help people be where they are and experience what they're experiencing, and what are the skills and tools and strategies that are available that can help. And that's coaching. So
Right.
We don't look to see who or what is the problem. We look at where are people, what is going on, what are the strengths that they have, the gifts and skills that they can bring to bear, where do they want to be, how would they prefer it to be, and then I help them bridge the gap.
So how would you begin? So when someone finds you and they come for their first session, how do you begin with them?
I ask them where they are and what's going on, what's working and what's not working. And after we explore all the things that are working and the things that are not working, I ask them what they want. Cindy, you would be shocked to know how many people don't know what they want. They're clear about what they don't want, but they don't know what they do want. And in order to help people get to where they want to go, co-create the kind of relationship and personal dynamic they want to create, they have to know what they want.
Yeah, I totally agree. A couple of years ago, I had my real estate license and I was selling real estate, and I really wasn't happy with it. And I left one company and interviewed at another boutique agency that I really liked, but she asked me, she said, I was telling her what other people were saying to me, and she just looked me straight in the eye. She said, "What do you want?" And I said, I don't know. I don't know what I want. And, until somebody really confronts you with that's when you realize this is why I'm floundering and I'm flipping my license and leaving different companies, because I'm not happy. I know what I don't like and what I don't want, but I can't quite nail down what I do want. And that is around the time when I got into doing vision boards, which were really eye-opening to me, and just really, really just putting down exactly what I do want. And now I have a clear vision and clear goals. And one of them was I got rid of my real estate license. I said, I just don't want to do this. And my life has taken another direction. And this is part of it. So, and that's such a simple thing to say, it's such a simple question. And who knew it would be so hard to answer?
With profound implications. And it's one of the reasons that people don't go there, because behind what do I want is, can I get what I want? Do I deserve what I want? What are people going to think about what I want? Can I really do it? What are my limits? Is it possible for me? Who am I to want that? All that stuff sits behind what do you want?
Oh yeah, we could talk for hours about this. Because those are all things that are going through my head as well too. It's like, you succeed so far and then you stop, and it's why, because do I really believe that I deserve that? Maybe I don't, maybe there's some other mindsets that need to change, things like that. So one of the reasons that I brought you on is because I interview autism families, and there's an 80% divorce rate. And what I'd kind of like to get to is what causes that. How do we get to that point? And it may be what we're talking about already. When you start realizing, what do I want? People may actually confront themselves with, I don't want to be married to this person anymore. I don't know.
So usually when people say, I don't want to be married to you, it isn't what they mean.
Right.
Sometimes people fall out of love and they really don't want to be with each other. Most of the time, it's not true. Most of the time, in my experience, and I've been doing this over 30 years, most of the time what people are saying is, I don't want this pain. I don't want to feel the way I'm feeling right now. And they mistakenly believe that if I'm not here, and if I'm not here with you, then I'll feel better. And it's not true. We take ourselves with us wherever we go.
Mm-hmm. Right. And to me, I always say, people think the grass is greener on the other side of the fence, and it's not, because you're still over there on the other side of the fence.
Satisfaction and the unhappiness and the disconnection is between us and us.
Mm-hmm.
At first we disconnect from ourselves, and then we disconnect from our partners.
Mm-hmm.
And then the relationship starts fraying.
Right.
But the disconnection first happens inside ourselves. When a child is diagnosed with autism, first of all, it's generally a long process, right? Although that tends to be shorter and shorter as we get further out, in terms of, now it's 2021. It's a shock, right? It's a shock. And the first thing that happens when people are in shock is they move into numbness and disbelief. And a lot of people don't know how to be present with each other in numbness and disbelief. If you're numb, if you're in disbelief, if I can't count on you, if you can't be strong with me, for me, then what's going to happen to me? And the next thing is that numbness gives way to, what is the implication? What is the implication for the child? What is the implication for me? What is the implication for you? And at that moment, people start grieving. And they don't realize that. We're grieving hopes and dreams that we had for our child. We're grieving hopes and dreams that we had for our family. I'm grieving hopes and dreams that I had to be a mother, to be a father. It's so complicated. And when people don't understand that grief is a normal, natural, necessary process, whenever there is a diagnosis, even if it's temporary, even if it's mono and the person will get better. If there's an injury and you know the thing that got injured, the part of the body that got injured will heal, there is still a grieving process. There's still a loss event. And the loss event will be recognized by our emotional self. And a lot of times most of the time, people grieve differently. The first thing that we want to understand is how much access people have to their feelings. Some people are very able to know what they feel. They have a lot of regard and respect for their feelings. They know how to process through their feelings. And then there's that range. And at the other end of the range, people don't want to feel their feelings. They don't respect their feelings. They don't honor their feelings. They're afraid about having their feelings. They're afraid about being in the presence of someone else who's having big feelings. That's one piece. People grieve differently. The grief process is as unique as our fingerprint. And so you're going to grieve differently than your partner, almost 100%. And so you want to be careful about the judgment that you have and the messages that you make. I have a really quick story about that. There was a couple who found out that their adult child was out of the house, but they found out that their adult child had a terminal diagnosis. And they went to this is a couple of days after they found out, and they were in the grocery store and they ran into somebody. And he said, the first thing he said to the person they ran into was, "Oh my God, Bob has been diagnosed with such and such," and just went on and on and on and on. She was stoic, tight-lipped. She didn't want to talk. She didn't want to be there, and ultimately said, "I'm going to the meat department," and walked away. She was furious. "This is private. Why are you telling everybody? I don't agree with some of what you said in terms of how we feel, what we're going to do, what we think, and don't do that." And he said, wait, you were stoic. You didn't cry. You didn't seem sad. You wouldn't talk. You walked away. And that was the beginning of them beginning to harm or hurt the relationship, because they were grieving so differently. They didn't understand what the other person was doing. They didn't understand to expect a difference. And then to say, what do you need? What do you need in your process? What do you need from me? What do you need from other people? So feelings, how much access we have to feelings, loss events, recognizing that it's a loss event, and grieving. And then the doing. Because at the end of any diagnosis of anything, you have to do something. You have to find out more. So you have to seek out research, doctors, facilities, tests. So now you've got to be in the real world, navigate the medical model, that whole system. And a lot of times somebody is more able or less able to do that, more able to make phone calls, to go to listen, to take notes, to ask questions. That's another thing. Sometimes people don't want to ask questions, and the other partner does want to ask questions. I'll never forget being in an office with my late husband who had cancer. And I didn't like what the doctor said. And I said, "Doctor, am I understanding that this is your standard of care? Your patient has said this, you've said that," and really questioned him very directly. My husband, God love him, did not know where to look. He was not happy that I was confronting his doctor and that I was disagreeing and I was asking for something different, which was ultimately what we did and on his behalf. But it is very often true that people have differences in style and temperament. So let me stop talking for a minute and say, was any of this landing for you, or what?
Oh, yes. Yeah. I just didn't want to interrupt. I wanted you to keep talking. Yeah, for sure.
Oh, I could talk for hours.
Because I'm going back to when Robbie was diagnosed. And I'm not stoic, but my husband is more emotional. Like, his reaction would be, he's Italian, so he wears all his emotions on his sleeve. I mean, there's no secret of how he's feeling ever. You always know. And he, he looked at Robbie's picture and cried, and he, and my reaction was more, okay, this is what it is, and what are we going to do about it? Let's go. And I didn't want him getting caught up in all these negative emotions and spiraling down into this constant, grieving, crying, depressed, whatever. I'm like, no. Let's go. Let's move on. Let's do what we got to do. I did grieve, though. And I do tell people that, I cried and I grieved, for about a week. And then I was like, okay, let's get her done. And I always felt odd saying that I was grieving because he didn't die, but what I tell people is, you know, you think you have one child. Like my husband was a baseball player. The first thing he did was he ran out and bought Yankees outfits for the baby. You know, we have pictures of him in his Yankees hat, and you right away have these dreams and aspirations for your child. Oh, he's going to play baseball. He's Robert Jr., you know, and he's going to play for the Yankees someday. And, you know, you have all these dreams and things, you know, about their wedding and all these things that are going to happen. And all of a sudden that child is gone. And now you have a child with a disability. It's like, oh, okay, that's not what I planned. That's not what I thought, you know, although when you're pregnant, you're always worried that is your baby going to be okay. To me, it was always in the back of my mind, you know, like, is my child, and they test the babies for Down syndrome, and, you know, is he going to be deaf? Is going to be like, you don't know what, you know, you hope and pray you're going to have a healthy child, but you don't know until they're born, you know, and maybe not everybody thinks that way. I don't know, but I did. And I thought, you know, you never know, you know, so I felt like I kind of prepared myself that, you know, you don't know if you're going to have a healthy child, you might not. But for sure, yes, I totally understand. And my husband and I do have different styles. Right. And he would be the one to tell everybody. And I would be like, they don't need to know our business.
Exactly. Yeah.
Yeah.
And how did he
Yeah.
feel about that? Did he have a reaction to your style?
I think he always relies on my strength to do,
Mm.
to do things and to get things done. I think it's just kind of always been that way. And he reminds me of my sister, that she's very emotional, you know, and I always say, oh, she's such a bleeding heart, you know, like, like for instance, they're on vacation right now in Washington, D.C., and they're going to see the sights. And instead she's running and buying food for the homeless so she can run around and feed all the homeless people. Complete opposite of me, you know, I'd be like, no, we got a schedule to keep. We got stuff to do. Let's go. You're holding me up. But I think you know, you can't, I think opposites, you know, can work well together. You know, you can't, you know, one needs to be the one to do this and the other one has to be that, you know, and I have to stop and allow myself to grieve. Like my son passed away. So I knew my tendency to keep moving forward, you know, let's not deal with these emotions, especially not negative emotions. Let's keep moving forward and go. And I had to force myself to stop and say, no, you need to deal with this. You need to stop. You need to take a break from everything going on in your life, and you need to allow yourself to grieve. So
Grieving is a normal, natural, and necessary response to a loss. That's how human beings are hardwired.
mhm.
And you said something very interesting, if I can pick up on that for a second, and that is you didn't want to feel negative emotions. And
Right.
it's the left brain that tells us that emotions are positive or negative. The fact of the matter is that all of our emotions are normal and natural and necessary. They all contribute to making us whole. And if you think about feelings like the plumes of a peacock,
Mhm.
the peacock doesn't say, I like the green feather better than the turquoise feather.
Mhm.
Right, we look at all the incredible colors in the feathers, and that's how our emotions, we want to regard our emotions, because they all have a job to do and they're all important. And if we understand that they all have a job to do and they all contribute positively to our wholeness, then we would not regard them as positive or negative.
Mm. Yeah, I think my fear is getting caught up in the negative, and like people that have a tendency to always be depressed or always be negative, I run from that, because it's one thing to feel that way for a day or two, but then enough, you know, like pull out of it. I don't know why I feel that way. I just, you know, I don't know. I fear being a depressed person, or somebody that's, you know, always angry or negative or depressed, you know, so I try to always pull away from that as quickly as I can. And even when I was grieving my son, I felt like I reached, you know, I think it was November, December, January. By February, I felt like I reached this crossroads where it's like, okay, enough now, let's go. Or I felt like if I went down this road, I would spiral off into this depression that I would never come out of, because I've seen people that have lost a child and it's been 10 years and they still are walking around depressed every day. I'm like, I can't be that person. I just made a conscious decision, like, okay, that's it now. Let's get back to business. I don't know.
So feeling feelings is different than behavior. A better example is anger and violence.
Mhm.
So anger is a normal, natural feeling. Violence is a behavior. And violence is not a behavior that is a progression of anger. So when we feel sad, depression isn't a normal outgrowth of feeling sad. So you can feel your feelings without having the exaggerated behavior.
Mhm.
So the people that are depressed or that can't step back into their lives, those are behaviors. And there are ways to positively impact people's behavior while you hold the space for feelings. They're not the same.
Interesting. So being sad is not the same as being depressed, you're saying?
Nope, not at all. When Mark passed away, I counseled all my clients for a week. And at the end of it, and I said I would be in touch with them soon. I didn't know it soon. They were all fine. And in a week, I said, okay, I'm ready. Was I finished grieving? No. Was I no longer sad? No.
Mhm.
And I was ready to be me, right? I was ready to be engaged in a life that I loved. I was ready to be engaged in the person I was being to make the contribution that is mine to make. And I was very sad. And I missed him. I still miss him
Mhm.
dearly.
Mhm.
And I can be back in my life. So that's what we want for couples. We want them to be able to experience the weight and the awfulness, the incomprehensible nature of what they've experienced, and not pull them apart, and be able.
I'm sorry. As soon as you said that I miss him, it just got it.
Okay, take your time.
I've been, plowing away with books and interviews and all this kind of stuff, and just talking about Robbie all the time without allowing myself to feel, because I need to keep talking. But you'll never hear me say I miss him, because because I do every day. Jeez, my turn. Okay, sorry.
Oh, don't apologize.
Okay. I didn't mean for this to turn into a session. Okay.
We're here to
turning
be
into a
present with
coaching
each
session.
other. Well, we're here with each other in whatever way we can support each other.
Okay, I'm sorry. Where did we leave off? Once you said I miss him every day, then I tuned out.
So we were talking about feelings and behavior, and that they're not foregone conclusions. We can be grieving, be sad, and not be depressed, and not be just
Right.
unable to be who we are in our own lives.
So if we can focus on couples a bit, so they have different, that just made so much sense that they have different grieving. When Robbie was 2, before he was diagnosed with autism, we thought that he was hearing impaired. And I had him in early intervention for hearing impaired children. And the parents, we would drop the kids off downstairs with the therapist, and we would all go upstairs and sit around a big table, and we would just chat and talk. There was supposed to be a therapist or someone there with us, but they weren't there for some reason. I guess they had retired and there was nobody there. So we all just chatted and talked with each other. But I saw a difference in the way dads were handling it compared to the moms. And it seemed like the dads, I don't know if it's the male ego or what, but they seemed to be more in denial and not really wanted to accept that there was anything different about their child. And they seemed to pull away a lot. And the moms were left doing all the therapies and everything. And the dads seemed to just become more engrossed in work or whatever excuse to not be around and not come home. I don't know. Am I generalizing, or is that?
No, and that's why there should have been a therapist there, and that's
Yeah.
why couples should work with a relationship professional that can be the vigorous advocate of the couple. In my experience, men step into the space that is prepared for them. And in the absence of somebody knowing how to prepare the space and how to invite them to step in and hold that space, men, I hate generalizing about men, but it is often what we see is that men have less access to their feelings. And that's an important distinction. They have less access to their resources, not less access to their feelings, to feeling, but less access to their resources and then to feel them, because when they feel them, what do they do with them?
Right. Well, I mean, I don't know about today, but I know in my husband's generation and my parents' generation, men were told not to be that way. They had to be macho, men don't cry, they don't show their feelings and stuff. So maybe that I don't know if that's an issue or what. I think my kids' generation is a little bit different. I don't think they're raised so much to not show feelings, but
Not show feelings, it's about accessing resources when they have big feelings.
like what, for instance? What do you mean? Like, can you elaborate on that?
So if I am thrown off kilter, if I am so disappointed, I'm so overwhelmed with the hugeness of what is in front of me, of what I might lose, just in terms of expectations and hopes and dreams. That's big.
Mhm.
And then we don't know what to do with those. People feel very guilty saying, I'm so sorry that I'm not gonna play catch with him.
Mhm.
That's a big deal. And people don't want to say that because it feels selfish. It feels trivial, except that's a real feeling.
Mhm.
I'm sad that we're going to never be in the kitchen together
Mhm.
the way that I had expectations. And so that's what I mean by access to big feelings and the resources that they can identify it, language it, find their courage, and then speak of it. It seems to be easier for women
Mhm.
than it is for men. But when you hold the space for men and you say, this is normal, natural, and necessary, this is part of the process, this is what people experience and how people restore wholeness, then they go, oh, got it. Because I've never been here before and I don't have a book and I don't know, I don't have any history to bring forward to support me, to help me.
Mhm.
And in the presence of somebody who really knows and is holding the space for normal, natural, and necessary, then people step into it. And then they know that it's okay to lean on each other. The other thing is that people sometimes don't realize that they must lean on each other. They must depend on each other. I loved it when you said that your husband depends on your strength.
Mhm.
And that's not true. Sometimes husbands see their wives as frail or so overwhelmed or so sad. And they don't realize that they have to do that in order to maintain their intact relationship emotionally.
Mhm.
Women will see their husbands and they may be mad at them because they have looks like they've stepped aside,
Mhm.
or they might be devastated and they don't want to add to it, or they might be dealing with outside pressures and they don't want to add to it. We've got all these stories that we tell ourselves. And then we believe the stories that we tell ourselves about all of this stuff. And what we have to do is stop telling ourselves stories and start telling the truth to each other. Start reorganizing our experience of our relationship. Marriages have a shared vision, partners have a shared vision. When you've got an ill child or a child with autism or any kind of a disability, you have to reorganize your shared vision. What is our vision for ourselves as partners and of parents of this child?
Right.
So we can still be rowing in the same direction. And a lot of times couples don't reevaluate what the shared vision is. They don't go back and reset the marriage, reset the expectations that they have of each other. They don't flush out the assumptions that they have about each other. It's devastating. All of that is devastating on the relationship. And so people deal with that internally alone. And when you start dealing with stuff internally and alone, then you're no longer, the fabric of your relationship starts fraying because you're no longer connected in that really strong, necessary way.
And that goes back to what we were talking about before, is setting a clear goal, like a new goal, and then doing that together. Because, I'm sure when you get married, I call it the Cinderella syndrome, where every woman dreams of meeting her handsome prince, living in a castle, having the 2.3 kids and a dog, and then when they don't get that, then not even with having a kid with a disability. I've had it with people that heard their husbands just suddenly ask for a divorce or whatever, and their life has changed, and they get, really angry because all their hopes and dreams did not come to life. But I think if the couples sit down now and reevaluate and come up with a new goal and a new vision, right, then that's
for themselves as a couple,
yeah,
for themselves as parents, for themselves as a family.
Yes. Right. And exactly. It's like, okay, it isn't what we originally planned, but let's come up with a new plan. What's plan B, I think also moms naturally, nurture their children, and they are all about taking care of their children and doing all of that. And men are more, providers, whatever, and easy to kind of disappear into work and not be involved or whatever. But as some of the moms that I've talked to, they said that they became consumed with their special needs child's care to the point where and I've seen it, where it becomes their identity. Like they are all about that, and they start foundations and, whatever. They are so consumed with that child that I think the husbands feel shut out. And it could, so yeah, if you could address that.
Yeah, I think that it isn't that the husbands feel shut out, the husbands are shut out.
Mm-hmm.
I want to add the word exclusion to what you just said.
Yeah.
They are so focused to the exclusion of their husband. And that is unhealthy. It's unhealthy for the mom. Most of the time that's driven by fear. It's understandable. Who doesn't understand that? And it's not good for the mom / person / wife. Because we're more than just moms, we're people,
Mm-hmm.
and wives, to real people who also have real feelings and who have capabilities and capacities to support us. And so when we do this sort of tunnel vision thing, we exclude help, we exclude support, we exclude softness. Sometimes people have said that they couldn't tolerate any compassion. They couldn't tolerate being taken care of. They couldn't let it in, because if they let in any being taken care of themselves, that they would just be a puddle, they would collapse.
What if the wife feels that the husband is not doing their share to help take care of the child, and they're not around enough, and they start getting resentful because he's never around, he doesn't help? But sometimes I wonder if, I know with me, I do it the right way. My husband doesn't do it the right way. You know what I mean? Like, oh, he washes the dishes in cold water. Oh, he doesn't brush the kid's hair right. He doesn't put the right clothes on. I think all moms are like that, whether you have special needs child or not. But maybe it becomes more exaggerated. It's like, no, listen, if you're not going to do it the right way, I'll just do it myself.
So that's a conversation, and it's an ongoing conversation about what you need and how you see the other person interacting with the child. Who are they? What do they want? How do they need to interact with their child? A story comes to mind. I had a client many years ago, literally many years ago. That's when they were bouncing. You didn't do this when my children were born, but they were like bouncing, sitting on a big yoga ball or the Pilates ball, bouncing. Mm-hmm. And he wasn't holding the baby right, and he wasn't bouncing right. And she said, "You can't do it. I'll just do it." And I said to her, there is no right or wrong. There's your right and wrong, but he's the father, and he needs to bond. This child needs to know who he is and have his experience of being comforted by him, even if it's not being comforted, or even if it's not being comforted in the way you want to see that he's comforted. This isn't any different. So we really want to talk to each other about what we need, how I want this done. And maybe you decide that you leave the room when he does it. Maybe you decide he doesn't do that thing. He does this other thing that works better for both of you. But it has to be a conversation. That's what I'm saying, is that you have all of this is mutual. These are really important concepts: mutual, reciprocal, and agreed. You have to have conversations and come to consensus, even if you agree to disagree. And then what is the strategy that we will use around X when we disagree?
Right.
And that's how you keep everybody involved and invested. And that's how you keep the relationship with each other strong. There's this mutual focus, and we figure out what that means for each of us and how we each contribute in a way that is aligned for us as individuals.
Yeah. I think it's probably hard for some couples to have these conversations. They probably just don't even know where to begin, how to start. And I think it would be really important to have a mediator, somebody in between that can kind of, facilitate the conversation and ask them questions. Well, how do you feel? What do you want?
That's why I do this work, because there's so many medical professionals attending to adults who are ill or disabled. And there are a lot of people attending to our children, the children.
Mm-hmm.
Nobody is paying attention to the couple. Forget the individuals, but there is a couple, there is that third entity that needs attention, that needs support,
Right.
that needs help.
What if a family is already divorced, but you still are co-parenting? Do you ever have that where you deal with two parents that are not married anymore and help
Yes.
them work this out?
Absolutely, because then you have a whole other set of problems once you're divorced. See, divorce doesn't really solve anything. It may solve a few little things, and then other things get created. Yes, so I have worked with couples to co-parent who were already divorced.
Right. Or maybe even were married in the first place, but they still are co-parenting, and they both have to get along to help their child.
Yes, and they still are partners. They're co-parenting partners, so they still can rely on each other. That's another important concept, is we rely on each other. It's okay to rely on each other. It's okay to be relied on. We just have to agree, what is that going to be? Can I be realistically relied on for that? Is that achievable for me to do for myself?
So do you do virtual consults?
Yes.
I try to. Sorry, am I using the right word? Consult or coaching sessions, or how do you word that?
Yeah, sessions, calls.
Mm-hmm.
Yes, I work on Zoom.
Because I do virtual consults. That's why that's the first word out of my mouth. But yeah.
No, that's perfect.
Mm-hmm.
Because I want to see people, and I want people to see me, and I want us to be able to look in each other's eyes, even if it's virtually.
Sure.
There's so much pain around this stuff, and while I'm not a visual person, and I can hear shifts in emotion on a phone when nobody's talking.
Right.
But there is something that is warm about being in the presence of each other doing this work. If somebody doesn't want to, or they both want to be on the phone, if somebody's traveling or something, that's fine. We can always do. I have an 800 bridge number.
Mm-hmm.
But whenever possible, to be on their own computers or their own phones in separate rooms.
Oh, that's interesting. I was wondering, that's what I was wondering. I'm like, do they sit next to each other on a couch when they call in, or what?
No. Separate rooms and separate computers or separate phones.
Interesting.
Because people key off each other.
Yes.
And, they're going to watch I want them to see the same thing I'm seeing. And then I could observe them watching and observing and reacting.
Oh, that's it. That's very interesting. All right. So if there's couples out there that would like some coaching services from you, how can they reach you?
Two ways. They can go to talk2drjackie.com.
Okay.
T-A-K, talk to Dr. D-R-J-A-C-K-I-E.
With no dot in there.
Yeah, no dot. Talk2drjackie.com.
Okay.
That takes people immediately to my Acuity online calendar. and they can make an appointment that says, let's talk.
Okay. Wonderful.
And then, or they can email me,
Mhm.
which is Dr. Jackie
Mhm.
at drjackieblack.com.
Okay.
Sometimes people want to talk, they want to just connect before they go make an appointment for a call.
Yes, I agree. Yeah, I would want to do that too. I would just want to talk to you a little bit first and then schedule something. So, okay, that's wonderful. Okay, well, thank you for joining me today. It was very, very enlightening.
It's my pleasure. Thank you so much.
And emotional. You brought emotions out of me that I didn't want to come out.
Most of the time, it's what I wind up doing.
Yeah.
All right, Cindy, thank you so much. Take good
Thank you
care.
so much. Have a good day.
Bye.
That's it for today's episode. I hope you enjoyed listening and it helped you gain a new perspective. If you're interested in buying our book series, Robbie's World and His Spectrum of Adventures, the link will be in our episode description as well as my Instagram and Facebook pages. If you enjoyed the show and you'd like more content, please be sure to hit that like button, follow us, and don't forget to leave us a great review. Thank you for joining us. Be sure to join us again on our next episode of Spectrum Perspectives.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.